Fiber arrangement. Parallel. They characterize the long muscles and are long, parallel to the muscular axis and present a great movement potential. They can be presented as in the examples, in the form of strips, sartorius, fusiform, biceps brachii, rectangular or rhomboid or triangular, pectoralis major. Oblique. They characterize most of the short muscles, appear in larger number and their fibers are oblique to the tendon line. They are presented as unipinnated, flexor pollicis longus, bipinnated, rectus femoris, or multipinnated, deltoid. Types of fibers. Striated skeletal muscle is not composed of one homogeneous type of fibers, but of two types with different contractile and metabolic characteristics. Slow twitch or type 1 fibers, slow oxidative, low. They use long-lasting aerobic energy. They have low levels of myosin ATPase. Slower contraction speed. They have the least developed glycolytic capacity. Greater concentration of mitochondria and these are more voluminous. High levels of myoglobin that provide their characteristic red pigmentation. Greater resistance to fatigue. Adapted to prolonged work. Receive greater blood flow. Fast twitch or type 2 fibers, fast glycolytic RG. They have a high capacity to transmit action potentials. Rapid release and uptake of calcium by the sarcoplasmic reticulum. High level of cross-bridge renewal. Generates energy quickly for vigorous contractions. Contract 2 to 3 times faster than type 1 fibers. It has twice the diameter of type 1 fibers. They depend essentially on the glycolytic system, anaerobic. They are divided into 3 groups. Fibers 2A considered intermediate because, despite their RG characteristics, they also possess the ability to transmit aerobic energy. Hence they are known as rapid oxidative and glycolytic, ROG. Fibers 2B true RG. They have high anaerobic potential. Fibers 2C are rare and undifferentiated and may participate in the re-innervation or transformation of motor units. Sedentary men, women and children have between 45% and 55% type 1 fibers and it is likely that type 2 fibers are equally divided between A and B although there are no differences in the distribution of types relative to sex. Due to genetic factors there are large differences between individuals. Some authors believe that in the short term it is not possible to change the predominant fiber type in a person, but the changes in metabolic capacity are considerable. Recent studies, however, demonstrate that in long-term training, there is the possibility of changes in the biochemical and physiological capacities that characterize the transformation. In relation to volume, endurance athletes have normal-sized type 1 fibers, while those in explosive training have an increase in type 2 fibers of up to 45%. This occurs due to the increase in contractile apparatus and glycogen reserves. Elite athletes in their specific modalities may have a high predominance of one type of fiber. Success, however, will be determined by other factors such as neurological, biochemical, physiological, and nutritional and technical support systems. Skeletal muscles are generators of force and transform stored energy into mechanical work. They are characterized by maintaining tone, changing their trophism, containing proprioceptive pain receptors, having origin and insertion, producing action potential in response to a stimulus, and having long, multinucleated fibers.